Hi everybody, this is Didi Verg from In the Know Radio, and today I have a pleasure of interviewing Dr. Scott C. Giles. Hi Scott, welcome to the show. The Reverend Dr. C. Scott Giles is a board-certified chaplain, a certified hypnotist, and a HeartMath certified coach. He is also the author of the Complementary Medical Hypnotism Certification Curriculum for the National Guild of Hypnotists. Dr. Giles, however, is most especially well known around the country, around the country for his work with cancer patients, where his published research supports the claim that hypnotism improves cancer outcomes. Scott is also the recipient of numerous awards from the National Guild of Hypnotists, where he is also a member of the advisory board wherein he carries out the legislation and governmental concerns portfolio. As well as having 2 degrees, one in philosophy and the other a doctorate in ministry, Scott is a multiple black belt martial artist and a former professional chef. Currently, Scott works at his private practice in Wheaton, Illinois, where he focuses on medical hypnosis and runs hypnotism clinics for cancer patients at numerous clinics in the Chicagoland. So, a degree in philosophy, a doctorate in the ministry. What is it that first caught your attention with hypnosis?
Oh, I've been interested in hypnosis, Didi, from the time I was 10 years old.
Really? Tell us about that.
I saw Dr. Ormond McGill. Now, you may not be old enough to remember.
I know who he is.
Okay.
Yeah.
I saw Dr. Ormond McGill perform his concert of hypnotism on the Art Linkletter show when I was 10 years old. And I was so fascinated that I sent away for my first book in hypnosis, which I saved for quarters from my allowance, and that book was advertised in the back of Superman comic books. Now, people my age may remember it. You had this little ad in the back of the Superman comic books, and there was this guy in a tuxedo, a drawing, standing over this woman dressed in a gown that she had obviously applied with a brush and a mirror, and there were lightning bolts coming out of his fingers. It was How to Hypnotize. Well, I sent away for that book. Now, hypnotism requires a certain kind of personality to do it effectively. And if you have that flair, it doesn't take a lot of information to make you really dangerous. And that's what happened to me.
Oh.
Now, the theory in the book was silly, but the techniques are what we teach in our state licensed hypnosis schools to this day for beginning practitioners. So I really did hypnotize my grade school classmates to sing the Star-Spangled Banner when the teacher began to erase the blackboard.
Oh no, you were a troublemaker.
Of course I was. They went along with it and thought it was just fun, but then they discovered they couldn't stop. And that's when it got scary. So I got into a tremendous amount of trouble. I was pulled from school, and of course my parents forbade me to have anything further to do with hypnotism. So naturally it became my life's work. I would sneak into the adult library before I was old enough to get a library card and go down the steps to the 100 level stacks in the Dewey Decimal System, which is where the books on hypnosis were. And I would read everything I could get my hands on, both wheat and chaff, I'm afraid. Years would pass. I went to the university, to Geneva Lombard Theological School at the University of Chicago for my doctoral degree, and I had the opportunity to study hypnosis more formally there. I loved it. So I then did a 2-year postdoctoral program with a practice affiliated with Rush Medical Center. And that was how I got into this.
So at Rush Medical Center, were you applying hypnotic techniques?
There was actually the Rush seminars in hypnosis. They were training people to do hypnosis. It was an extended program supervised by some of the best people in the world at the time. Wow. So I really had the benefit of excellent instruction. Now, most people at the time were using hypnotism as a tool in psychotherapy to bring repressed material up or whatever. That wasn't my interest. My interest was in how hypnotism could be used as a tool in medical healing. Now, at the time, I was a parish minister and serving a church in Oak Park, Illinois. And there were 9 women in my congregation who had breast cancer. And back then, the chemotherapy and radiotherapy regimens we have now were nowhere near as sophisticated. So those 9 women came to me and asked if I would work with them hypnotically to help control the side effects of their treatment to make it more manageable for them. There was virtually no literature on how to do this. So I literally made things up as I went along. But all 9 did far better than anyone thought that they would do, whereupon their doctors wanted to send other patients. And within a few years, that completely took over my career. I made the jump from parish ministry to what we now call community ministry, which is you work with the wider community. I've been doing it full time since 1991.
And specifically working with people with cancer.
Medical conditions in general. 70% of my clientele have cancer.
Wow. So what have you noticed with cancer patients? Because I've also interviewed other medical hypnotists who have noticed a certain kind of pattern, and I kind of run it by everybody. So for example, she noticed that she said, Didi, no matter what, they have suffered a big trauma that they haven't been able to get over at least 3 years prior to the cancer.
That was the original theory. Back when I had a chance to train with Dr. Bernie Siegel out of Yale New Haven Medical Center. He published the first well-received book in mind-body medicine back in 1978. The book was called Love, Medicine, and Miracles. And at the time, that theory was being kicked around a lot, that there was some major loss 18 months to 2 years prior to diagnosis. And that was, if you look for it, you find it.
Sure.
But what other people have noticed is that if you take anyone,
they've had some kind of
a loss
in 3 years, yeah.
Right. So that probably isn't what's going on. But we do know that cancer is a condition that is not caused usually by one thing. There are a series of things that conspire together that allow the cancer to become manifest. It can be your genes, it can be the exposure to toxins, exposure to ionizing radiation, it could be lots of other things. Stress is certainly part of that. And if you've had a serious stressor in your life that's been sustained over a long time, your body does change under the weight of that stress. Specifically, you produce a great deal of a hormone called cortisol and less of a revitalizing hormone called DHEA, dehydroepiandrosterone, which would be protective.
Sure.
So a lot of the techniques we evolve working with cancer patients are how to minimize the production of the stress chemicals and maximize the production of the vitality chemicals. And there are techniques that you can use hypnotically and just other self-help techniques that allow that to happen.
And I noticed, because you're a HeartMath coach, that's one of the things they teach, that just getting into a state of gratitude for 2 minutes ups your DHEA by like 60%, is it?
And sustains it over a long period of time.
Right, so it's the actual opposite to the stress hormone. So just by feeling gratitude for your life or people you love in your life.
Yeah, and you're correct in that word you just used, feeling. It isn't a positive thought that does it. It's a positive feeling.
It's a feeling, sure.
You got to be able, the techniques that the HeartMath Institute utilizes of first distracting yourself from stressors in your life and then putting yourself into some memory or frame of mind where you have a deep positive feeling is part of what creates the biochemical change that can be sustained over time and even shift your baseline of stress chemicals versus vitality chemicals in your body. And so this is all research-based, all outcomes-based.
Yeah.
It's not metaphysical at all. There's nothing wrong with metaphysics, just that we don't need to go there to explain how it works.
So being that you've, totally explored hypnosis for so many years, what have you seen that's inexplicable in terms of what hypnosis can do?
Well, I think there is kind of a non-local learning.
Okay.
Lots of hypnotic practitioners will talk about this, that when you're in deep rapport with a client, when you're doing a piece of hypnotism and it's really working well, the client is absorbing the suggestions well, they're utilizing the time, you are also going into your own hypnotic state. You're present with the client in that heart space. And sometimes there comes to be just a flash of inspiration or intuition that you know that this is exactly the right story to tell. This is exactly the right parable to use. This is exactly the right suggestion to give. And you may not intellectually know why you choose that one rather than some other one. But it is right, and that's created by the energy of the interaction itself.
Yeah, it's sort of an intuition, it sounds like. So with the research that you carried out in hypnosis with cancer, can you tell us a little bit about what those findings were?
Sure. What we did at LaGrange Memorial Hospital in 1991, I created, with the cooperation of the hospital, obviously, the I CAN program. It's an acronym for I Can Act Now. What we did in that program was the first medically approved hospital-based program to explore hypnotic interventions into cancer. These were all people admitted to the program with progressed cancer. And what we did is we work with them every week in a group setting, small group setting, using deep group hypnotic techniques. And we all got to know each other very well, and so the techniques really became quite, I think, personalized for all of these people. And what we found is that after 10 years, survival basically doubled. That is, our people at year 10 and beyond had a survival that was better than the estimated 5-year survival for their cancer when compared to the National Cancer Outcomes Database.
So that's quite prolific.
That is, and on the basis of that, I was then invited by the University of Chicago, my little company, Mary Hospital, and 2 wellness centers in the greater Chicagoland area to create other programs that might be helpful. Now, in my practice in Wheaton, the only service I charge for is one-on-one consultation from my office at Wheaton. That is the only service there is a fee for. Everything else I give away. The I CAN program runs with a small fee charged by the hospital to cover expenses, but that's it. And I created 3 free clinics for cancer patients. Wellness House in Hinsdale, Wellness Beyond Walls in Palatine, and Little Company in Mary Hospital. And we work with 75 cancer patients a month for free in those 3 locations.
That is unheard
of
of nowadays.
It takes my entire Saturdays. That's why I'm not going to be here at this convention tomorrow, because I'll be with my program in Hinsdale. But so the reason I did that is people who are living with cancer, by the time they get to me, they're often tapped out financially.
Sure.
They're on disability, they pay the deductible and co-payment on their insurance policy. Now, some of those people still have the financial resources to pay for personalized one-on-one care, and there's always been enough of them that my practice stays going for 25 years now. But many of them cannot. But if you come to me, I can help you no matter what your financial condition is.
Sure.
If you can't afford to pay me for the focused work, I can bring you into one of my group programs. I can still help you there. And we've been doing that for years and years and years now. More than 2 decades.
Really amazing. So with the cancer patients, those ones, like obviously there's going to be some you're going to lose, but the ones that make it through the cancer, just because I'm quoting Lance Armstrong, he said it was one of the best gifts I ever had because it made me more of a, what was his quote, stronger man or something morally, I think he meant.
Well,
but what have you discovered, like when they've come through the cancer and all is said and done, has it really helped them to change their lives in a positive way?
One of the things we do see with long-term good responding people who are living with cancer, and by the way, that's the proper term we try to use, long-term good responding. We don't really like to talk about cure for cancer because by definition, it's a condition that can recur after a long period of time. So the standard joke is, you know, the patient was cured of cancer when the autopsy showed the patient died of something else.
Yeah.
So, but the long-term people who do well, a lot of them will use the time of their treatment and subsequent recovery to reinvent themselves. And that is one of the things we've learned to look out for, to kind of see who's doing really well and who's utilizing the techniques to the maximum effectiveness. Now I didn't discover this. There's a great book called Cancer as a Turning Point.
I've read it. Yeah, he's fantastic. Yeah.
Dr. LaChan's done some of the fundamental work in personality type and cancer care. And what he found with cancer, most people want to make changes in their life, but they have a hard time because they're embedded in relationships. And the other people in these relationships don't fundamentally want you to change because they are comfortable dealing with you as you are now. So if you start changing who you are, that forces everyone else around you to change how they deal with you.
Sure.
So they may start doing what we call change back maneuvering.
Ah, so
Are
making
you
it a
sure
little
that therapist
difficult.
is helping you? Or,
Yeah,
you know,
making it a little difficult.
Trying to get you to go back to
Yeah.
being. But cancer is a disease we as a society project our fear onto.
Mm-hmm.
So people are, and we shouldn't, because most people who have cancer will survive it, but we do. We fear this disease more than many others. So when you have cancer, that is so shocking to the members of your extended family system that they'll leave you alone if you make a change in your life.
Isn't that
you have
interesting?
a unique opportunity
Wow.
to alter your behavior.
Because
in a
nobody
way-
can say a thing about
and they'll
it.
stand back and let you do it without a lot of change back maneuvering. So during this time, you have a unique opportunity to do this reinvention. Now, it can be big. I've had a former IBM executive who's now a custom gunsmith. You know, he makes elaborately carved shotguns and 2-year backlog of work. He used to joke that he commuted to work on the Burlington Railroad. Now he commutes to work in his slippers because his machine shop's in the basement of his home. One health professional, a little strange story. She's now dancing at a club out by out her airport called Heavenly Bodies. She became an exotic dancer. And she says she's
that's
making
really-
more doing that than she was working at the hospital. Now, I've never seen her act. She's invited me, but I've never
The
gone.
Reverend
I've
hasn't
never
gone?
gone. No. I think it would be unethical. Now, I can't find anything in the Code of Ethics that would say it's unethical, but
You just know it
it just
is.
feels like a boundary violation. But she's doing it for all reports. In fact, last report she was being groomed for management. But not all of these changes are as
Pronounced.
obvious as that. Like, one person always wanted to be a chef. Well, he became a serious amateur chef. One person wanted to be a poet, but he became a stockbroker instead because that was practical.
Right.
Well, he discovered he could go back to writing poetry, and using CreateSpace, the online demand publishing group from Amazon, has self-published several books of his poetry, which have gotten some good reviews. So if you can't get your whole dream, sometimes you can get a little piece of it, and that will be
Sure.
enough.
Sure.
But you're absolutely right. During this time, you have a unique opportunity to become who you want to be.
So because I read that book by Lawrence Lashan, he was fantastic. He also said that 75% of people with cancer have lost their meaning in life. So maybe they were like a stockbroker and they're like, I don't know why I'm living anymore. I always wanted to be a poet.
We find this with actually a lot of the chronic conditions, not just cancer.
Oh, interesting.
Heart disease is another common one where we find this. There's a thing called Black Monday syndrome. The American Heart Association has done a lot
That's
of
right. Most
research on
people
this.
have the heart attacks on Monday.
Right, first 2
Right.
hours of Monday morning.
Right.
These are people getting ready to go off to jobs they hate, jobs that are killing them. And it occurs to their unconscious mind that we don't have to do this, we could just die. And they
Right.
do.
Yeah. It's
And
the only way out for them,
They
I
feel
would
trapped.
suppose. Yeah.
And I've seen people who have embraced their illness as the solution to dead-end job, the solution to a relationship they need to get out of but are not willing to get out of. You see this happen. But these days, less and less. I think people are taking more responsibility personally for the management of their own health and their own energy, and that's having a salutary effect on the population as a
I
whole.
think at this point people are so stressed out, they're like, look, it's just not worth it. I don't care. If it's going to be like this, I'd rather be broke and be a poet, or if that's what they think, right?
Well, and I think also the lessons are being learned that there's no such thing as security.
Sure, not anymore.
You
yeah.
may put up with your corporate job thinking that that's secure, but the reality is these days that corporation's going to fire you the moment it's in their advantage. To do
Yeah, or
that.
it's beneficial to them.
They're not going to feel a bit of loyalty to you, and people are realizing that there isn't any security in the dead end jobs they hate either.
Right.
So more and more are being willing to downshift, move to a different footprint in their lifestyle, and find a way to be the people they want to be.
Yes. So
That's
people are
the
being
big-
more true to themselves
I think so.
nowadays because they realize,
There's no time like the future.
Exactly. So what have you seen in terms of other medical conditions, for example, pain? a lot of people with cancer have a lot of pain. So how can hypnosis help with pain management?
There are lots of ways to manage the various kinds of discomfort, and there are many different kinds of discomfort. For example, neurological pain is very different from bone pain, which is very different from muscular pain, and so on. And we've developed formal hypnotic techniques that hypnotists are trained to do to utilize the body's capacity to alter how pain is experienced. Now, it's important to know that we never actually take pain away. Pain is diagnostically significant. We don't want to mask it.
It's important, yeah. It's there for a reason.
So what we do is we change how the brain processes that information. So you still know you're in pain and can tell your doctor about it, but it doesn't matter to you as much and doesn't affect the quality of your life as much. For example, my buddy, he likes these little Mexican peppers from hell. What are they called? Habanero peppers or something?
Habanero peppers,
Right.
yeah.
And now, if I get a fragment of one of those on my tongue, I want to die. He eats them.
Raw?
I'm not sure he does that, but he eats a lot of them. Now, you got exactly the same chemical
Yeah.
hitting exactly the same organ of the body, the mouth and tongue, but totally different subjective responses in my mind versus his.
It's pleasure to him.
Right. I'm perceiving it as pain, he's perceiving it as a appetite stimulant. Now, nothing physical going on there, it's just the interpretation of the sense data being made by the brain.
Right.
Now, hypnosis can't change the fact that you may have a bone cancer, but it can change the fact of how your brain processes the information coming from your nervous system about that cancer and lower the threshold of pain, or increase the threshold of pain for you. Also, we know that just the presence of cortisol in your body has the effect of amplifying pain.
Yeah, the
So
more stressed you are, the more
So
tense you become.
simply relaxing a person profoundly will have the tendency of bringing the level of discomfort down. Now, the difficulty with this kind of discomfort management hypnosis is it does take time. Cortisol, the chemical that's implicated in the stress chemical, has a half-life of 12 hours. This means when you've experienced a strong negative emotion and cortisol has flowed into your bloodstream, 12 hours later, half of it's still there. So that's why when you had a bad day, you try to go home and go to sleep.
Yeah.
You can't because half that cortisol is there,
Still there.
effective as a stimulant. It takes 5 half-lives to completely extinguish something in your blood, so 60 hours.
Oh.
Negative emotions cast a long physiological shadow. Whereas DHEA, the vitality hormone,
Sure.
half-life 15 minutes to 35 minutes. Doesn't
last
Doesn't
long.
hang around.
Oh.
But so when we work with a person for pain management, we want to bring the cortisol level down, but it does take time.
Sure.
We've got to retrain them to bring that level down and let everything that's in the blood extinguish itself. But that's a doable task.
So it does take a bit of time, probably
takes
about a
time.
week, or how long does it take to kick
60
in?
hours, 60 hours. Is
60
what we
hours,
say.
so 4 days. Well, roughly.
So, but with that, we can get a lot done.
Wow, that's fascinating. And what about, because I do know there was a hypnotist I interviewed who had very fair skin. And she actually got into hypnosis as a result of cancer having her prevent burns. Without any hypnosis, she was blistering up and burning. And as soon as she started the hypnosis, no problem with the radiation. That's amazing.
We can do that. Different people have different responses to radiation based on your skin quality.
Yeah, she
Some
was the
people
type with the
just
really
tan,
fine, yeah.
It's like I'm very fair-skinned. I joke if I walk past the building where we're doing radiation therapy, I get burned.
Yeah.
But yes, you can do a great deal to alter how the body responds to that. And part of that is again, just the relaxation. All muscles in the human body are either smooth or striate. Striate muscles have ridges on them, hence the name. They're controlled by your central nervous system, your major flexors. But the smooth muscles are controlled by your autonomic process, your unconscious or subconscious mind. You've got smooth muscles under your skin. And if they are agitated, if they are clenched, you will tend to scar more, you will tend to have a much harder time with anything that tenses or challenges the skin. Whereas if those muscles relax and blood flow goes easily, the effects of the burns can be minimized.
And I would assume the hypnotic relaxation, which I consider a true relaxation, because sometimes, I mean, relax while you're under radiation. It's not going to happen. It's not going to be a true unconscious relaxation. But with the hypnosis and just going into that trance state, I believe those muscles really do relax.
They do. That's also how we minimize scarring when we're doing pre-surgical work, because what happens when the incision is made or there's been a wound, those muscles clench in a primitive reaction to try to get as much tissue away from whatever is causing the wound. And unfortunately, once clenched, they tend to stay clenched. They don't relax again. So that space granulates in, and we call that a scar. But if we can relax those muscles, the edges of the scar are bent smoothly, and we have minimal scarring.
Ah, so a pre-hypnotic suggestion going into, you'll be relaxed.
Certainly. And to relax deeply all tissues, including the smooth muscles under the skin, minimizes scarring, boosts healing.
Fantastic. And what about, controlling bleeding after surgery or pain after surgery?
You gotta be careful with that one.
Right.
Yes, you can do that. It's anything that's sheath in a muscle, and all the blood vessels are sheath in a muscle, can be affected by hypnosis. But, for example, in dental work, you want that to bleed, because that's washing away bacteria.
Ah, okay.
And if you're working with someone for dental work and you give a suggestion to minimize bleeding on the surgical field, you create what's called a dry socket, and that gives new dimension to the feeling of pain.
Oh.
Also, bleeding to some degree elsewhere in the body is there to flush away bacteria. So there are limits to what you want to do, which is why if you're going to do medical hypnosis, you need to be properly trained in it. There's a danger of someone just a basic certification trying to do this sort of work without learning the proper precautions. And they may do something like, inadvertently restrict bleeding or mass chest pain or other sorts of things that can be very dangerous.
So a kind of suggestion you might give would your body bleeds exactly as much as it needs to cleanse the wound.
That would be a safe one.
Yeah, so it would be something like that.
Either when you give those kind of suggestions, if you know what needs to happen on the basis of scientific outcomes data, you can directly suggest that.
Right, and the body should, in theory, carry it out.
If you don't know, just work with general imagery for health and healing, or with a lot of cautionary word in that. Wording like you just did.
So interesting, so interesting. So, but post-operative speeding up healing, how does hypnosis work for that?
Well, again, there are a number of different ways to approach it depending upon what the underlying condition is. Minimizing scarring is one. If you do that for the surface of the skin, you're doing it for any area that's had an incision as well, and that will facilitate healing. Boosting DHEA through positive imagery amplifies the healing response, boosts the immune response. So these are effective, very general, safe things to do. Just have a person focus on a happy, positive future. That reduces cortisol, promotes DHEA, that promotes healing throughout the body. If you've got a specific issue that you know about, then there's something you can do to help with that. But again, you have to know what you're doing. Like if you're working with someone who's got arthritis, well, you have to know, is this osteoarthritis or is this rheumatoid arthritis?
Okay.
Because an osteoarthritis, something that should be in the joint, has been removed. And rheumatoid arthritis, something that shouldn't be in the joint, has been added. So the imagery you use needs to be correct for the condition that you're working with.
Yeah, that makes total sense. So what are the miracles, especially even if they're medical miracles, you've seen in your career as a hypnotist?
I think any oncologist out there who's been working for a while will have stories of miracles. And so I have them too. Even though I'm not an oncologist, I work with that population. The people sent home to die who show up for a physical 10 years later, the spontaneous remissions that we cannot explain, the blocked heart artery that when we go to actually put the stent in, we discover the artery's blocked, no longer blocked. It's completely clear. The body is a wonderful self-correcting mechanism. Often something has gotten in the way of that self-corrective ability. And if we figure out, or the person figures out how to remove that, then just like a rubber ball that's been crumpled, it will go back to its proper shape. And conditions can spontaneously resolve themselves. And we see that a lot. For people who are type 2 diabetic, they may be on their metformin or other drugs. We work with them hypnotically, and they suddenly discover that their body can, in fact, process the insulin correctly. And all of a sudden, the metformin's not necessary. The blood sugar, stat sugars are good. A1Cs are good. Diabetes just can correct. We have seen heart disease in many cases clarify. I myself have a heart condition that was believed to have been extremely dangerous for me. And in fact, I joke that I'm 24 years beyond our expiration date because I wasn't supposed to live much past 40, but here I am. Now, some of that is there's been new medication developed and I respond to it well. But a chunk of it is a good lifestyle. I mean, I run a scratch kitchen, I work out, I'm a martial artist. I use self-hypnosis to process and release negative emotion quickly. That's vitally important. Again, staying on the DHEA side of
rather than the cortisol.
Right. That makes an enormous change. So the miracles, they're not miracles in the sense that they have no explanation. I mean, we can, in medical, the joke is in medicine, we can explain everything and predict nothing.
Okay.
But if something happens, a miraculous healing like that, we can understand how it happened, but we don't know how to cause it. It just happened on its own.
You realize after the fact how it happened.
That's the miracle. The spontaneous healings.
Wonderful. You've seen lots of them?
Not lots, but I've seen many.
Many. Wonderful. So if you had one last thing to leave our audience with about just how powerful our minds can be, what would that be?
If it were up to me, we would teach self-hypnosis in high school. I think every person in our society needs to take responsibility for the management of their own emotional energy and not let other people and other circumstances dictate that. By using the tool that I believe God gave us, the ability to experience the hypnotic state and to respond to suggestion, we have the capacity to take control of our own life. Not just to keep ourselves happy, but to also avoid inflicting harm on others through excessive demands. So what I would take with you is learn self-hypnosis, learn to do it for yourself, and do it often.
Well, it's definitely helped you.
Yes, it has.
There's a case in point right here. So thank you very much.
My pleasure.
It's been wonderful having you.